Here we are at Ladies Night Out at the CDI Breast Care in Waukesha, and I was telling you how I was so excited because with the news of Angelina Jolie, we have a genetic counselor, and Jenny Gertz is with us, and you said you've been doing this 8 years?
Just about.
And I bet people have really started to talk about it this week with this in the, the news.
Yeah, and that's been the interesting phenomenon because we've had genetic counseling services here in the Milwaukee area for decades, literally decades. And, every once in a while we get some attention, but with Angelina Jolie coming out with this announcement, we have never been so busy.
I think the celebrity is what, obviously put the light on it, because I would imagine, like you said, there have been women doing this type of, is this considered preventative, I guess?
Yes, and we actually have some really wonderful hometown stories of women in Milwaukee who have gone through genetic counseling, found out about their family history, and made a very difficult decision to have this surgery and go through this and spare themselves from having to go through breast cancer.
It's really extreme, but it's a personal choice, I would think, for women. And I'm sure there are women that are watching that are wondering, should I have this gene testing done? How do I know whether I should do this?
Yes, anytime a celebrity speaks out with something like this,
right,
everybody thinks, oh boy, is this me?
Yeah.
Do I have those same risks? Should I be having the genetic testing? But I want to go back to highlight that for breast cancer, and we say 1 in 8 women get breast cancer, startling fact, but the majority of women who are affected by breast cancer do not have a hereditary form of the disease. In fact, the majority of women diagnosed with breast cancer actually don't have a family history of it at all.
Yeah, that's interesting, because everyone assumes if mom had it or grandma had it, then my chances are higher, and not necessarily.
Well, and the reverse, that if my mom never had breast cancer, I'm not at risk. And that highlights an important point where just because it's not in your family doesn't mean you can skip a mammogram.
Right.
Okay?
That's a great point to make. So what are the red flags? What should a woman look for?
Right, so when we're thinking about hereditary cancer, we really want to take a look at the family history. So hopefully somebody has some accurate family history. We often say Thanksgiving is a great time to talk about family history because the families all gather together. Right. So, hey grandma, what about aunt so-and-so or cousin so-and-so? And get that history. Find out who in the families had cancer, what type of cancer they've had, where it started is important, and the approximate age of diagnosis, because we think that cancers that are diagnosed at a younger age are more likely to be hereditary.
Okay, so in Angelina Jolie's case, her mom was like 56 with this ovarian cancer. That was a huge red flag.
Yeah, and ovarian cancer in general is a big red flag for us. Anytime we see ovarian cancer in the family, we say it's worth a genetics consult.
Really?
So
talk about the consult. So is this like a questionnaire you fill out? What is it, blood? What is it?
Well, the first step is talking with the doctor. So that's really, if you're concerned about your family history, ask your doctor if you should see a genetic counselor. Then when someone gets to me, what we like to start off with is the family tree. So I draw out their family tree, ask how many relatives they have, who's had cancer, and that determines their risk profile. And then I have some fancy computer algorithms I use to calculate a woman's risk for breast cancer and talk about if she's a good candidate for breast cancer gene testing.
And this is testing for this BRCA1.
BRCA1 and BRCA2, exactly.
Okay.
So the genetic counseling allows a woman to understand what the test is about, the benefits, the limitations, and also, is it right for her in her particular situation? So there's a couple questions that I always ask families when they come and see me. Number one is, do you want to know?
Right.
Do you want to know this information? Because it can be psychologically quite damaging.
Sure.
But I think for the reality, for the most women I see, if they have a strong family history, they're thinking about it anyway.
Yeah, it's sort of hanging over your head, yeah.
Right, and I always say putting your head in the sand is not going to make it go away. So addressing it and talking about what can I do to help reduce my risk of cancer or prevent it altogether, or detect it early. And that's where things like breast MRI become valuable in early detection of breast cancer.
So if you are diagnosed positively in this gene testing, it doesn't mean you could choose to remove your breast, as she did, or you could choose to do just extreme preventative MRIs and more regular mammograms, self-exams.
Self-exams.
So there are options. It's just all you weigh out your own choices as to how to handle it.
And that's what personalized medicine is all about, understanding what your risk is.
Right.
And then taking into account, what are my values? What is my lifestyle like? what does my family think about this? And making the best decision for you. And that's why I really hope Angelina Jolie doesn't catch any flack for her decision, because it's such a personal decision.
Yeah.
And no one should judge her for that.
I
And
agree.
it was right for her.
Right, and a lot of people might think it was great, a lot of people maybe it was too radical, but it for her worked, and it worked for her family, as we've seen Brad Pitt talking. Well, this is really, really helpful, because like I said, everyone all of a sudden is paying attention to this. So again, Jenny is available. I guess, can I refer people to you if
Yeah.
they're interested?
Yes, at Frederick Medical College we have a program for genetic screening, but for viewers that may be outside of the Milwaukee area, there's a National Society of Genetic Counselors.
Didn't know that.
nsgc.org. I'll give them a plug, and you can find a local genetic counselor in your area.
All right, thank you.
You're welcome.
We have wine and appetizers waiting for us now, so we'll talk to you later.